Hi, it's Jessica Damasa with WTF Health. What's the Future Health? We are talking to all sorts of different health tech startups about what is going on in our industry in the face of COVID-19. And so today we are going to talk health policy and regulations. Yes, those special regulations that have changed in order to make telehealth and remote monitoring possible. And so joining us to give us a Washington insider's point of view, we have Leslie Krigstein. She is the Vice President of Government Affairs for Livongo. Leslie, it's so good to have you with us.
Jessica, thanks. It's great to be here with you.
Thank you so much. Okay, so I've been following along with this, and like everybody else in the industry, very excited about the things that have been eased up in order to make telehealth remote monitoring possible, have it reimbursed at parity within office visits, all of those things that have made our lives a little bit easier, made everybody very optimistic that this is it. The time has come for digital health. Can you just give us a state of play of what's going on with these things? I mean, this is one of those, I know those regulations have been lifted for a period of time. Is there an end date on this? What's going on with those regulations that have been lifted and what we can expect?
That's great. Yeah. So we have seen so much progress in so little time, right? 10 years plus advancement in the short span of a few months where, HHS has really used just about every ounce of their authority to do their best to make digital health available for, all Medicare beneficiaries and make it as easy as they can on doctors and on the clinicians that are providing the services. So much of that is predicated on the public health emergency, which is at Secretary Azar's discretion. So it is generally done in 90-day increments. So we have got about a month left on the existing declaration. And from there, we'll really start to get a glimpse of what HHS, what CMS can do without Congress acting, and then what's going to take some additional action from Congress, which is a challenge. They're, in and out of DC. They're trying the remote thing too, like we are. So seeing some unprecedented activity from lawmakers adjusting to the new normal. But there is, unfortunately, some timestamps on some of these changes. So, relative to telehealth, the changes to 1834M, that pesky 1834M that has really hindered the broad reimbursement of telehealth in Medicare, is tied to the public health emergency. Whereas some of the changes on the remote monitoring side, CMS and HHS more broadly do have some existing authorities. So hopefully we'll see some of those stick around even after the duration of the public health emergency without Congress having to act. So,
okay. So let me make sure I've got that right. So the changes to Medicare require the act of Congress, and some of these other things that are right now kind of making remote monitoring more possible are the things that HHS has more say into and can move forward with without an act of Congress. That's right?
Exactly.
Okay.
Exactly. So that virtual check-ins, e-visits, those are the things that CMS historically has had more ability to manipulate, whereas Congress, unfortunately, very definitively set out years ago what telehealth was. They defined telehealth as audio-visual communication that can only be delivered to certain places at certain times using certain modalities. And that's what Congress, via the CARES Act, said, okay, here, HHS, you have a little bit more authority during this public health emergency to do more, to almost have a pilot of sorts, where there's been a lot of clamoring for industry for years of, let's try telehealth in little snippets here or there, or let's look at certain populations. We got a nationwide pilot for expansion of telehealth and remote monitoring over these last few months. And, to see the report and uptick in volume is borderline mind-blowing, which is fantastic. So yes, it's going to take a little bit more to get us completely solidified in these policies for the long term. But there are some things, especially on the remote monitoring side, that we should be optimistic about because, given the comments that Administrator Verma has made. Lots of folks have said that genie is out of the bottle.
Yeah.
So what can we expect and when can we see it? So we are waiting with bated breath for the physician fee schedule that will tell us a little bit more about what might be coming in the remote monitoring space.
Okay,
so,
let's unpack this a little bit more, because I want to make sure I understand this, and I want to make sure that our viewers understand this as well, because this is a little bit complicated when it comes down to it, and there's a lot of very specific wording and things like that to really be aware of. So when it comes down to, and I guess I'm going to phrase the question this way: what can we be optimistic about, and what should we be concerned about? So if you could give us a sense of, when you say, for as far as remote monitoring is concerned, there's a lot to be optimistic about there. What kinds of things are you talking about?
So within CMS's current authority, they can do things like change. So there's those existing remote monitoring codes that have been able to be billed for the last several years. They can expand those codes. They can decrease some of the time thresholds or the professionals necessary to do the code. They can increase the reimbursement rates. All of that is within CMS's existing purview.
Okay.
So they can, really take those steps. The other piece that's also up for debate as to what HHS can do or not is this notion of waiving the cost sharing requirements.
Ooh.
So right now, if a physician believes that they would want their patient base to experience remote monitoring, to benefit from remote monitoring, they don't have to charge them a copay. And so that's something that there's debate in the industry as to whether or not Congress would need to say it's okay to do that, or if the HHS can just say, no, you're right, we can revisit this copay structure and make remote monitoring and digital health more broadly more cost effective for these Medicare beneficiaries. So, relative to virtual check-ins, e-visits, remote monitoring, those are the things that you see iterated on progressively year over year from CMS and their payment rules. But it's the telehealth piece that we've been really anchored to the very specific language that Congress passed so many years ago. And that's what's hindered that broad approach to opening up telehealth reimbursement in Medicare, was that, you had restrictions on could you get it at home, or, where were you located in the country as to whether, you needed to be in one place versus another. Those are the things, unfortunately, that are going to have to get Congress's perspective and require congressional action. And that could be a challenge under any circumstance. But, as we saw during the Senate Health, Education, Labor, and Pensions Committee hearing, there really is a lot of interest. So although it's not an easy road to hoe to make some of these changes on the telehealth side permanent, there is broad-based, bipartisan, bicameral interest in not forcing these beneficiaries back into the prior, pre-COVID status quo, that beneficiaries are happy that, these members are hearing from their constituents that they like being able to talk to their doctor at home. They like being able to get their, their mental health treated via the phone at a time that's convenient for them. So although, there are thousands of bills introduced every Congress and just a handful of them get signed into law, there is definitely reason to be optimistic. And so, I think we're seeing this recognition from lawmakers that there is a new standard of care. That new standard of care is telehealth. That new standard of care is remote monitoring. And we need to do all that we can to make digital health approachable and accessible to as many Americans across the country as possible. So whether you live in Vermont, like my parents do, where, there is an hour and a half between their home and the border, that if I am in, I may not have cell service, to those living in Midtown Manhattan, and making sure that regardless of who you are, where you live, who your insurer is, that you have the same access to telehealth, to remote monitoring. And even, Jessica, I think something that's really interesting that's unfolded in the last few days was we saw the first bill that I'm aware of that would incent providers to make investments in remote monitoring by providing grants for them.
Yeah, so, I saw that.
recognizing that if an individual across the country lives in rural America and doesn't have access to broadband, that at least their providers can help them have that real-time ongoing data flow to allow for chronic care management in a more effective and efficient way via remote monitoring. So that's something I think we can be really excited about, that we're not just kind of stopping and starting at telehealth, that we're really looking at how we can completely transform care and really meet the individual where they are, whether that's in their home, in a nursing home, in urban or rural scenarios. Chronic conditions and mental health isn't something that is choosy based on geography. So we see this, broad approach to really welcoming digital health. I think that's something we all can be excited about and have a lot.
I want to get a little bit of dirt on that, if you don't mind, as our Washington insider. Tell us what the sentiment is. Like, what are you hearing when people talk about, like, because I remember at the beginning of this pandemic, watching the Trump Rose Garden press conference where he trotted up all of American healthcare, onto the stage, and he had a conversation then, and then talked about this new thing called telehealth. And I just thought to myself, like, oh my God, they think this is new? Like, I mean, I know that we've been kind of fighting that battle amongst the healthcare incumbents sometimes, depending. But, it's like, I was curious about, like, are lawmakers really aware of this? And I know truthfully, all kidding aside, that there's a lot of people who are just not aware that you could get care remotely. And that's been one of the challenges for telehealth or remote monitoring from the very beginning. The sentiment on Capitol Hill, like, what are you hearing? Are they like, are they excited about the possibility of this? Is this something that's been on their radar? They're excited to move it forward? Is it new and they're still trying to understand it? Like, what's the sentiment around it?
That's a great question. I had a similar reaction when the president referred to it as new and innovative. I kind of paused and looked at my husband and said, this has been around for a while. But nonetheless, it's great that it's really become front and center in the nation's response to COVID. And that's what we're seeing on Capitol Hill. Is it is bipartisan. It is bicameral. There have probably been dozens of bills introduced in the last few months about trying to get telehealth more broadly, or digital health more broadly, advanced within particular communities. There is recognition that we need to do more and do better by particular communities too. So making sure that, access and equity is appropriate and is equal across all Americans. And so I think it's here to stay. I think there's, for the most part, been really a chorus of support from, the average person. My parents are both Medicare beneficiaries. They are both living with type 2 diabetes, and they did their first ever telehealth visits at the outset of the pandemic. Their longtime primary care doctor had them install Zoom, and, they were able to still have that connection with him. Fortunately, they both use Livongo, so they were able to share, these have been our readings, both for their diabetes as well as their hypertension, and have that dialogue as if they were with him in the exam room, as they have done for the last 40 years.
What do you think?
They were sold. The same goes for my 89-year-old grandmother, who, really has a challenge getting in and out of the car. And, if you've been in Vermont during the winter, you're trudging through snow, and they had snow into early May. So the fact that, again, she was able to see her doctor via, my mom's laptop and have that discussion with him and, show where her aches and pains were and just do that general checkup, that really, puts my parents, minds at ease. It helps with her in terms of feeling that connection. And I think that was one of the takeaways from them was, I still feel connected. And I think it was one of the concerns was, are you really going to, is this new standard of care going to feel cold? And the fact that you can still have that interaction and have a meaningful relationship with your providers, I think still comes through. And we heard that during the hearing. Even one of the senators was saying, my daughter had a dermatological issue and we used FaceTime with the doctor, and I went and picked up the steroid that they prescribed within hours. And this is how it should work. And that's exactly right.
There's like a whole world of telehealth companies right now cringing. Krigstein is not a telehealth platform. And
I know.
Acknowledge you. Yes, we're right there with you. I get it. But it's kind of stepping people over. I do want to go back to, Leslie, one thing that you were talking about just a few seconds ago, and cheat a little bit on what we were saying in the pre-interview chat that we were having about access to digital health and access to remote monitoring, telehealth, and how this might become an issue that's kind of wrapped up in, equality of access. Say a little bit more about that, because I think it's really interesting. This is one of those things like I feel like I have been talking about this myself for a couple of years now, just because I think it's, there's an inequity in terms of access of who's got high speed internet and who doesn't, and who, is technology going to become, part of the social determinants of health conversation. And so I'd love to hear what you're hearing about that among lawmakers and in Washington.
Yeah, I mean, there's been a significant amount of discussion coming out of the pandemic of, is telehealth and digital health only available to some and only accessible to some? And the reality is, because we don't have a robust broadband infrastructure, that's an impediment to traditional telehealth. So we've seen CMS embrace the audio-only pieces of reimbursement as the pandemic has progressed. But that notion of real-time extra data, that's where remote monitoring solutions that may not need high-speed internet, that may be backwards compatible to 2 or 3G, they can still enhance that interaction, even if it has to default to just being over the phone. So the provider can still see a certain level of granularity without, seeing the individual face to face. So I think that's part of the discussion. Is you look at rural America, and even in some, circumstances, whether that's, impediments to transportation, whether that's hundreds of miles needing to be traveled, or whether that's you don't have a car, or you've got kids, and getting to a physician on, public transportation is going to take you hours and cost, hours of your wage. And so I think there is a notion of, we do need to pursue equity. We do need to acknowledge that there are shortcomings. And I think, unfortunately, some of the reticence in the Medicare space to fully embrace digital health, unfortunately, has resulted in this notion of the digital divide. Because those who may be on government insurance plans, who may be underinsured, telehealth is a nice to have. Unfortunately, for some of these plans, it's not a must have. And so, as the pandemic has demonstrated, there is significant value to the Medicare population, to the Medicaid population, for having access to digital health, to making care more convenient and keeping folks healthier, as opposed to having to resort to that very acute focused healthcare system. So, that's something at Livongo we're working on, whether that's looking at tribal communities and seeing how we can get more resources out into those areas that may lack high speed, have significant provider shortages, whether that's looking into rural America and saying, we can help bridge, the divide when there's no broadband, or looking into urban communities and saying, these are shortcomings in some of the healthcare offerings. Telehealth, remote monitoring, those e-visits, they should all be cornerstones of what care should be moving forward. And that's how we're going to have a healthier population. And so that's definitely, I would say, front and center in a lot of the conversations on Capitol Hill is, how can we make sure everyone has access? Right. And I think it's really important, because it is the new standard of care, and it should just be the new standard of care for some and not all.
Right.
So
Absolutely.
We're excited to see those conversations and excited to engage in them too, and help find those real, tangible, valuable solutions.
I want to ask about others kind of helping push forward this cause. So, we are a relatively new part of the healthcare industry. In terms of health tech, right? There are a lot of health tech companies are startups, very much in a growth mode. It don't often get to talk to a startup that has a government affairs person, let alone one who's very active in terms of helping kind of work to, influence conversations or bring things up. So, it's awesome that Livongo is doing this, but it's how can the rest of us kind of support this and join in? I know that there's typically like in healthcare, you've got the professional organization for the subspecialty of medicine or for the hospital group or the AMA, or you've got AHIP, and they do a lot on behalf of the constituents they represent. But we really don't have that at this point. So how can other digital health companies, those who are in telehealth, remote monitoring, what can we do to kind of help represent our beliefs about what should happen and do our best to help push this stuff forward?
It's a great question. And, the DC world for some can be daunting.
Yeah.
Ask what I do. I fully embrace and say I'm a swamp creature. That's the reality of what I do, right? No, but the reality is, especially as it relates to digital health, is it's still, like you said, it's new, and the administration, Capitol Hill, everyone is clamoring, everyone is thirsty for information, for data. So for those, whether you be well established in the industry or you be a small startup, whatever story you have to tell, now is the time to tell it. Because, whether it's Congress looking to overhaul some of these existing telehealth rules or CMS iterating on the policies of the past, this is an unprecedented opportunity. I equated it to a nationwide pilot. So tell the story, share the information. It's a, well-kept secret that any of these rules that the administration puts out, anyone can comment on. There is a public link that you can send a 2-line response to or a 100-page response. But it's really critical at this point to make sure that you're telling your story, because we may not see this amount of progress again for another, decade. Hopefully it doesn't take another pandemic to advance the healthcare system, but that's just the reality in which we're living in. So, Livongo invested in government affairs. I joined the team in January, and there really is a small club in DC that is focused on digital health. So the more the merrier. There are many great stories to be told. And, really taking that chance to tell the work that they are doing, that their the experience and the outcomes. There's always going to be some level of criticism about embracing the new, but those of us that are, carrying the torch and ushering in this new era of medicine, we should be doing it together. We should be doing it in unison. And now is the time to do it, louder and prouder, because we can't go back. And that we have that pulpit to stand on and share the message. So, you can, engage formally and informally, but, folks shouldn't be nervous. Now really is the time.
Awesome. Well, we're excited. Thank you so much for living in the swamp and dealing with that for us. I know there's the tech scene here in San Francisco is like, I don't know. But no, thank you so much for everything that you said, and also just for checking in with us and giving us the insight. It's like, we're all kind of following this stuff, and I think, trying to, the politics of it and also the legalese of it is just so nuanced. And so I really appreciate you, walking through and unpacking all of that for us. Leslie, thank you so much. And we definitely, folks, you need to check out the blog that Leslie just published up on the Livongo website. Very good in terms of unpacking what it is that we want to have happen and what it is that we don't want to have happen when it comes to these new legislation initiatives around remote monitoring and telehealth. So Leslie, thank you so much for stopping by. It's a pleasure to talk with you, a pleasure to meet you.
Thanks, Jessica. It was a great conversation.
Thank you. All right, guys, I'm Jessica DeMassa. Definitely check out, like I said, Leslie's blog, and you can always find more interviews with those who are leading the charge for change in healthcare up on the WTF Health YouTube channel. Just go to youtube.com/WTF Health. Thanks so much for joining us, you guys. We'll see you soon.